Hello and welcome to this video on anemia, the causes and treatment. Anemia is caused by a number of things. The most common is going to be dietary issues, such as being vegan. Other causes and nutritional issues are somewhat unrelated to diet. It can be due to genetic disorders. There are issues to do with red cell production. Sometimes it's due to your red blood cells being destroyed. And there is always the, always reliable blood loss, where due to unforeseen circumstances or vampires, you lack blood to speak of. As should be well known to most people, blood is important. It's needed for life if you're not aware of why blood is important. Each red blood cell carries a small amount of oxygen around the body for a period of roughly 180 days. At the end of these 180 days, each red blood cell is destroyed in the spleen. This allows the human body to salvage and reuse the basic parts such as iron and hemoglobin. Everything else is in the red blood cell can be considered a loss. There is almost nothing else that can be salvaged and reused, at least not on a relatively large scale. And that's because the red blood cell does not really have many organelles or DNA to speak of. As each red blood cell lasts for about half a year and the replacement is somewhat slow, it's important to know how and why the production of new red blood cells occurs. First, we should say that the proper term for red blood cells is actually erythrocyte. It's a combination of the terms for cell and blood, but for simplicity and clarity we'll stick with red blood cell. Next we have the short version of how red blood cells come to be. Each red blood cell is made in the bone marrow where hemopoietic cells are located. These are the cells that give rise to all of the other blood cells, such as leukocytes, platelets, and, rather obviously, red blood cells. And for this video we will focus on just red blood cells. That is, the cells that follow the hemocytoblast or multipotential hemopoietic stem cells to the common myeloid progenitor and then eventually to the erythrocyte end of the branch. The fact that you need to differentiate red blood cells and to get them to form one thing and not another means there must be a way to do so. The most potent means of this is EPO or erythropoietin. This is a hormone that tells the body to make red blood cells. Without that, the red blood cells just do not get produced. Your body doesn't communicate the need for an increase in number. Typically, erythropoietin is made in response to low oxygen levels, and that means that so long as the body thinks it's oxygenated, you will not get erythropoietin produced. One way this can happen is if there is an external oxygenation source, such as an oxygen mask or ventilator, and that causes the blood to be oxygenated without red blood cells. While possible, this is more on the rare end of the causes spectrum. On the more common side of things, we have the actual growth or development of red blood cells, rather than the message going in that can create anemia. The proliferation or differentiation of red cells is a very wide group of disorders. The easiest example to understand is leukemias, particularly as to how they outgrow and outcompete red blood cell progenitors. In simple terms, you have white blood cell progenitors that should produce the various leukocytes needed to protect your body from pathogens and various other threats. As the number of circulating leukocytes goes down, the body thinks it needs to grow more progenitors for these. That is, cells that will lead to an increase in white blood cells being made. That leads to a slow but steady increase in the number of progenitor cells in the bone marrow. That also slowly outcompetes and sort of pushes out the red blood cell progenitors. The gradual process causes a slow decrease in the rate of red blood cell production, and therefore replacement. The only treatment for this is twofold. First, you can hope to not do anything and wait, and this is typically what happens. There won't be any major intervention until things get bad. And typically this is done until the second option is required. And that second option is going to be the transfusion of blood until a suitable bone marrow donor can be found and matched. The bone marrow in the original person is ablated with radiation and then replaced with the donor's marrow. This should lead to that excess and overwhelming leukocyte progenitors population being wiped out, admittedly with the red blood cell progenitors as well, but the new bone marrow being introduced should have the appropriate balance and allow for the production of all things in balance, let's say. In a similar kind of problem, but focused on red blood cell progenitors alone, we have it where the same progenitor cells get stuck partway through the differentiation process. That is, they never get to a stage of being fully developed or matured red blood cells, but somewhere earlier in the process. This can be okay, let's say, in some cases, where the cells still mostly work, just not quite as well as they should. In other cases, they may not work at all. And in other cases again, you get a mixture of mature and immature red blood cells. This is not an easy thing to treat, but it is possible to treat. The only real way, though, is, much like with leukemia, literally ablating and then replacing bone marrow with a transplant. It's why, if the individual patient has a reasonably completely functional cell, or at least doesn't have any major downsides, they're unlikely to go down that pathway until things get complicated or there are other issues arising. The example of not proliferating or differentiating properly may also be because of something like aplastic anemia. Aplastic anemia has the stem cells or progenitor cells replaced with fat. That takes bone marrow from up to 70% stem cells all the way down to very low numbers, and in extreme cases single digits. This is treated in a very wide range of ways as the cause is incredibly diverse. The treatments also overlap with the cause, but include things like immunosuppression, steroids, chemotherapy, and transplantation. The problem is that about half of all known cases are idiopathic, or in other words, there is no known cause, it just happened. And as per Dr. House, idiopathic as in we don't know because we are idiots. Better known and evidenced is the dietary pathways. That is, rather obviously, not just limited to your iron consumption, but a range of other things. But to start with, you have food and similar directly affecting your ability to produce red blood cells. The most obvious, as mentioned, is iron intake. The problem with this is that the onset as a result is slow and not really obvious, with signs and symptoms being comparable to general fatigue and malaise. The solution is simply to consume more iron-rich foods or to take multivitamins or similar that have iron content. If it gets to an extreme point due to gastrointestinal issues that we'll describe later that will prevent iron absorption, then IV iron transfusion may be used instead. But in general terms, that's a rather more extreme approach. One of the major things that can and does lead to iron deficiency anemia is a case of a B12 deficiency. A vitamin B12 is required to both effectively absorb and then use iron. This is called pernicious anemia. The simplified explanation is that due to a lack of vitamin B12, DNA synthesis and replication problems will occur. Without vitamin B12, you cannot get the differentiation of the progenitor cells that split, and while splitting, they make a new progenitor cell, but the second cell is also what will give rise and differentiate into a red blood cell that circulates around. It ensures you always have the ability to make more red blood cells, while also making the needed new red blood cell. Rather obviously, being a vitamin, and vitamin B12 in this case, it's primarily something you have access to through your dietary intake. Other issues that can be related to dietary issues are infection with something like Helicobacter pylori, which will affect your stomach's ability to not only mechanically process food, but to an extent, the production of the hydrochloric acid within the stomach to break down said food. This can be dealt with a combination of antibiotics and, for a limited time frame, the use of something like, say, hydrogen channel blockers. You also have certain autoimmune conditions that affect the ability to absorb food. The gluten-related disorders are particularly common, but whether it's celiacs, Crohn's disease, or anything else really, if it interferes directly with the ability of the gastrointestinal tract to be permeable enough, or in some cases to simply provide the necessary means of absorbing the nutrition within food, you will rather obviously experience issues around absorption and therefore the necessary nutrition for red blood cells. Inflammatory conditions like inflammatory bowel disease is exactly the same thing. You experience the same problems in that because of the changes that occur at a physiological level, you simply can't get the necessary nutrition. The next kind of anemia, or at least cluster of anemias we want to talk about, is the premature loss of red blood cells. This can occur a number of ways, much like with dietary intake. The largest, let's say, group of these includes the red blood cells being attacked by the immune system, which occurs for a range of reasons. Other times it can be simply down to hemolysis, or the breakdown of red blood cells. In the first situation, it's perhaps easier to understand. With the immune system, you can trigger it to recognize red blood cells as foreign and therefore need to be destroyed, basically overly zealous inquisitors. The way this happens is going to vary a lot, as mentioned, but the major pathway we'll talk about first is going to be your warm autoimmune hemolytic anemia. That is, because of a change in temperature in the body, IgG, which is immunoglobulin G, tags red blood cells and says these aren't what they should be, therefore they should be destroyed. And because of this, the body begins to attack them and take them down. It's mostly associated with other conditions, for example lupus, and various other conditions, but the only real way to deal with it is immunosuppression. In a similar way, you have a cold agglutination hemolytic anemia, which is more or less exactly the same idea, it's just cold causes it, and the mediator is IgM. Unfortunately, as far as mechanisms go, it's really just suppressing the immune system again because, well, it tends to be idiopathic, and idiopathic means it's really hard to stop the cause. We can treat the symptoms and the mechanism, but not why it's happening. One of the ways to treat it if it is happening is simply blood transfusions, but these themselves will carry some of these same issues. If you give somebody the wrong blood type, or it's not closely matched, and this is one of the issues around blood typing and blood transfusions, you'll find that you can get the immune system to start attacking it for no other reason. Admittedly, other mechanisms can achieve the same thing, like viral or bacterial infections, where due to the large-scale response by the immune system to these infections, they improperly associate red blood cells with this previous pathogen, and so keep attacking them thinking they're just part of the same bad thing. The solutions and treatment are kind of limited. Mostly it's just trying to suppress the immune system and stop any subsequent flare-ups or reasons for the immune system to attack red blood cells. It's really hard to do anything else about it. Mostly because, well, unfortunately, the main target that it's looking at, your blood, really can't be replaced. It's not something that can be dealt with easily. Theoretically, you could do a complete bone marrow replacement, but that's an extreme option. And, of course, trying to prevent flare-ups isn't always possible. One situation in which this may not be possible is the hemolytic disease of the newborn. As an example, it's fairly horrifying. It's when the mother's immune system attacks the developing fetus due to a different blood type. Oftentimes it's the rhesus blood type rather than the ABO system. This is generally dealt with by using anti-antibodies that stop the immune system from recognizing the fetus's blood type, and thereby protect it, at least for the majority of the pregnancy, from being damaged or attacked. And typically speaking, this is good since most people who are at that stage of pregnancy tend to want to stay that way until the child is born. In a similar way, sickle cell anemia causes the loss of red blood cells, and this is down to partly the immune system and partly structural issues we'll discuss later on in the video, but for now though we will focus on the autoimmune element. The first issue is you have the way the sickle cell shape causes issues of recognition and function. This is really not easily dealt with, as the primary cause, or at least partial cause of this, is going to be the genetics. So if you have only one genetic copy of a sickle cell gene, the condition will be reasonably managed, as the amount of cells lost, let's say, will only be up to half of the red blood cells in your body. The problem though is that if you have two copies, that is, all of the copies of the gene in your body that lead to sickle cell anemia are just that, well, you really only have one option, and that's transfusions. Historically, that's basically been the only thing you can try, and it's keeping somebody alive between the sudden issues or bounce of cells being destroyed. In recent years, genetic modification has become viable and appears to be working quite well. In terms of what's happening, the various changes to the structure of the cell and the problems it creates because it gets caught in places, and it's almost like a really questionable car on the road. Once it breaks down, it causes all sorts of other issues for the rest of the traffic, and so it eventually gets towed away and destroyed. That's sort of what happens with sickle cell anemia, in very, very crude approximations and analogies. But it does bring us to the genetic pathways, particularly since genetic modification is the primary means now of treating sickle cell anemia. The genetic change pathway, although an option for sickle cell anemia, isn't really possible for other causes. And that's because a lot of these are either dealt with more effectively through care, or, in some cases, we don't have a treatment available. And in the latter instance, well, they're more of a ticking time bomb. The first way you can look at this is the intrinsic options, or intrinsic problems, let's say. These are things that are inside the red blood cell. Mostly these are going to be defects in either the membrane itself when it's being differentiated and developed, or it's going to have to do with the way the structure inside the red blood cell doesn't work the way it's supposed to. And unfortunately, a lot of times these really can't be dealt with at the moment. These are examples of genetic conditions where you just don't have solutions. So you have hereditary spherocytosis, which leads to the red blood cell not only being marked for destruction, but prematurely marked for destruction. Hereditary elliptocytosis is the similar sort of problem, but again, it alters the structural elements of the red blood cell itself, and as such, treating it's more or less impossible, because it has to do with the way the red blood cell is made during the differentiation process. A beta-lipoproteinemia, again, very similar, but where the other two have to do with the membrane itself, or with the various skeletal parts that hold the, let's say, membrane together and in the right place. This alters the lipids within the membrane. Less easily handled, but theoretically much more viable targets at the moment are those that are based on enzymes. There are two big enzymes that are going to be relevant: pyruvate kinases and glucose-6-phosphate dehydrogenases. In both instances, it's generally a deficiency in these rather than a failure of the enzyme itself. So theoretically, genetic therapies targeting either an increased production or simply to provide these could treat it, but again, that's very much a hypothetical. The pyruvate kinases have a problem where they create a defect in glycolysis. That's the a breakdown of various glycogens, and the glucose-6-phosphate dehydrogenase deficiencies affect glutathione synthesis, and this leads to a oxidative stress situation. The last group are your hemoglobinopathies, basically any pathology of the hemoglobin itself. Sickle cell anemia is one of the better known examples, where a change in the hemoglobin, that is what holds the oxygen, that causes a somewhat substantial change, rather obviously given it goes from being a donut shape to a sickle shape, in the red blood cell. You also have other changes that are less specific, let's say, and they can be in a wide number of places within the hemoglobin. And these are all called hemoglobinopathies, but what they do is they cause instability within the hemoglobin. And as such, you end up with problems around the hemoglobin lacking the structural integrity and therefore beginning to cause the red blood cell to simply not maintain the correct shape, which can cause issues around the movement of oxygen into and out of the red blood cell, or in other cases, the red blood cell itself can, in very oversimplified terms, implode. Finally, we have trauma, or perhaps it's better to say hemorrhage. That is, the delay between the blood loss experienced and the replacement of lost red blood cells. Ideally, something like this would be treated with a transfusion and fairly quickly, but that requires not only suitable blood being available, a recipient being able to receive said blood, but also that you're not going to have unwanted side effects, amongst many other issues. In some cases, there will be a big enough gap between blood loss and possible transfusion, if possible, that the individual will experience anemia, although in this case, anemia is perhaps a slight misnomer, as, well, blood loss and hemorrhage is somewhat different again to the typical anemias you might think of. Understand, it is still, strictly speaking, a form of anemia, just rather unique by comparison to all of the others, which are much broader in nature. This is one reason why just being told you're anemic might not be very helpful. There is a wide range of causes. That also means that treating anemia can be much harder than just consuming more iron. In some cases, it may not be possible to treat at all. It's simply down to the nature of what it is. And you might have to, well, to use a very bad analogy, do a hard reset by literally wiping out the bone marrow and then putting new bone marrow in. Admittedly, it's not a perfect solution in all cases, and in some cases there is no treatment at all possible. Not a difficult treatment, but just none at all. Thank you for watching. If you found this interesting, consider liking, sharing, and subscribing. Please do post any comments, questions, or suggestions you have below.